Hi guys, I'm Dr. Rajat and today's topic for discussion is dental implants and oral hygiene. The loss of teeth today is no longer a problem. More and more patients go through implantology treatment that allows them to recover not only their natural smile but also many cases their self-esteem. If oral hygiene is fundamental in general terms, those patients with dental implants should know how to proceed. So the question is how to clean dental implants to prevent dental problems. As you may know, dental implants is a titanium screw that together with crown replaces a tooth. It is important to maintain good oral hygiene. Is hygiene in dental implants different from that of the rest? So in principle, the hygiene around dental implants should be simple and very similar to that of the teeth. There is a fundamental factor to avoid accumulation of bacteria around them, and the processes like crown and bridges are well adjusted and adapted to the implant. Adjacent teeth and gums, for this you must meet some requirements like the crown must fit perfectly with an implant, leaving no spaces. Now for this verification you have to take radiographs. If the crowns are cemented, there should be no traces of cement under the gum. The technician must design a sufficient space between the teeth so that the interdental brush can pass through. The contact points between the implant and the crown should not pass food scraps that are then packed into the gum, and they're very annoying. So for these reasons, it is essential to work with good dental technicians and laboratories with high quality standards. So next point is, are specific hygiene products needed? So if there are single crowns, if I may talk about, they will be cleaned like rest of the teeth with a soft toothbrush or electrical toothbrush. And if you have dental bridges, we recommend using dental floss or floss to eliminate bacteria that remain under the pontic. When there are long span processes like a hybrid processes or a polo molo or the entire arch which is screwed or implanted, there are on a market specific brushes to clean the processes, and sometimes the irrigator also may be very useful in the processes. They are more difficult to sanitize in cases where the patients have manual dexterity. So if you talk about, you can imagine the periodic checkup are very essential to update dental health, especially if you are a patient with dental implants. So oral hygiene is a very important factor in the good prognosis of dental implants. So you can do a periodic checkup. For this case, if you have any query regarding this video, you can email us at drrajasachdeva@gmail.com.